Alright, this is my breast cancer presentation. What is cancer? Cancer is a term for diseases in which abnormal cells divide without control and they can invade nearby tissues. Cancer cells can also spread to other parts of the body through the blood and lymph systems. A couple risk factors of all cancer: aging, alcohol consumption, carcinogens, chronic inflammation, poor diet, hormones, immunosuppression, infectious agents, obesity, radiation exposure, sunlight exposure, and tobacco consumption. Tobacco consumption, sunlight exposure, and alcohol consumption stimulate new cell growth that can increase the risk of a faulty replication. Women are at risk 100 times greater than that of men. A couple other breast cancer specific factors are birth control, combined postmenopausal hormone therapy, DES, that's pain medicine for women in labor, radiation exposure, not getting enough exercise, a family history of women related to you with breast cancer, mutated BRCA1 and 2 genes, not having any children, having a high breast density, and menstruating before the age of 12 and after the age of 55. The TNM scale determines which stage of cancer you're at, and T stands for tumor size, N stands for lymph node status, and M stands for metastasis. So here's the prognosis for someone with breast cancer. At stage 0, you have precancer. The tumor is not any particular size, so it says TIS. However, when you progress down to greater stages, the T's will increase incrementally as well as the N. And at stage 4, you'll finally reach metastasis, where cells will replicate in different parts of the body. The 5-year survival rate at each stage, so beginning with stage 0 and 1, is nearly 100%. Stage 2, over 90% or around 90% on average. Stage 3, 70%, and at stage 4, women are expected to have a survival rate of 20%. So treatments for breast cancer include surgery. That could include a mastectomy or lumpectomy. Mastectomy physically removes the entire breast and mammary glands, whereas a lumpectomy only targets cancerous growths in more rare cases. Chemotherapy kills or disables cancer cells, and adjuvant chemotherapy is administered after surgery is already performed to prevent further growth, whereas neoadjuvant chemotherapy shrinks cancerous tumors before surgery, so that way women have the option for a lumpectomy. Radiation therapy kills cancer cells, often given after lumpectomies. Hormone therapy prevents hormone receptor positive cancer cells from receiving hormones that stimulate their growth. And targeted therapy only targets a cancer's protein, HER2, that is found on the surface of a couple of them. The risks of treatment. Surgery does not actually spread any cancer, so there are no risks to surgery. Chemotherapy, you may lose your hair in most cases, brittle nails, nausea, vomiting, fatigue, nerve damage, and muscle pain. Radiation therapy, you'll experience short-term skin tenderness, and some women may have lymphedema. Hormone therapy, um, the example I provided was taxamorphin, and when you're on this drug, you're experiencing hot flashes and night sweats, a loss of sex drive, and a myriad of other side effects. The purpose or the reason for these side effects is because the hormone therapy prevents any cancers from being stimulated to grow. And in order to do this, natural female sex hormones have to be suppressed. And targeted therapy brings no harm to healthy cells, so there are no risk factors to anyone's knowledge. In order to prevent breast cancer, you must abstain from the leading cause of breast cancer, which is abstaining from alcohol. Um, Other prevention methods include controlling your weight, not smoking, exercising, breastfeeding, limiting hormone therapy and duration, and avoiding environmental pollution or exposure to radiation.